Hi friends, this is a video on low back pain because it is one of the most common complaints that people have when they come in, and it is one of the more poorly understood types of pain that people have. And so I wanted to narrow a little bit in on sciatica, which I've chosen because people have a tendency to self-diagnose themselves as having sciatica. And so what is sciatica? Well, most people think it's low back pain, it's butt pain, and that can be true. Sciatica is specifically a compression of the sciatic nerve, and the sciatic nerve is the thickest nerve in your body. It exits your spine very low and travels through the back of your hip, down your bum region, the back of your hamstring or the posterior part of your upper leg, and innervates most of the entire lower extremity. Some of the less serious causes of sciatica can be a tight muscle or a muscular imbalance close to the spine. So the muscles of your low back can be very tight and can pinch the sciatic nerve where it exits the spine. And or your glute muscles can be very tight and it can become compressed by your hamstrings. So these big muscles in the back of your upper leg, or a couple of those muscles if they're all tight. And so symptom-wise, most people complain of pain in their back or their bum or their hamstring. Symptoms can also be numbness and tingling, either again in the back or the glutes or the hamstring. And if the sciatica is severe or chronic in nature, has been going on for a long time, you can actually start to experience weakness or a lack of motor control in the muscles that are innervated by that sciatic nerve, which is a lot of them in your leg. So you might notice difficulty pushing your toes down into the floor, bending your knee, bringing your heel closer to your bum. And these are all things that you definitely want to get checked out by a doctor. Because if the cause of your sciatica is muscular in nature, that's relatively easy to address. And we really do that through manual techniques such as massage therapy, physio, chiropractic maneuvers as well. But the most important factor is stretching. And that's beautiful because that's something that you can do on your own. If you have been checked out by a doctor, you have been given the go-ahead to do some soft tissue release in your low back, glutes, hamstring muscle to alleviate the compressions of your sciatic nerve, then you can go ahead and follow me. I'm going to show you a few different exercises and stretches to help alleviate the compression of your sciatic nerve if it is in fact caused by tight muscles of your low back, glutes, or hamstring. As a little caveat here, if part of your symptoms are numbness and tingling and you do feel an increase in the numbness and tingling as we're going on, don't be concerned about that. If the tight muscle is pushing on your sciatic nerve and we're stretching it, we are temporarily increasing the tension of that muscle, but once we let go, it's going to be less so, okay? So if you have an increase in numbness and tingling, go ahead and push through it. If you have an increase in pain though, I want you to either back out of your stretch until it doesn't feel painful anymore, or I want you to cease the activity altogether. But all you should be feeling is a soft tissue pulling sensation, just like a muscle stretching, or an increase in the numbness and tingling that you're feeling. But there shouldn't be any increased pain. So with all that said, let's go. Okay, so we're just going to start warming up the spine by increasing the flexion and extension and getting some mobility happening there. Again, if you feel any pain, especially with extension, you're going to not go into the movement as much, or just don't do that movement altogether. Coming to your all fours, you're going to breathe in, look up, drop your belly. Exhale, round the spine, look down, push away from the floor. Inhale, drop the stomach, arch the back, look up. Exhale, round the back, push away from the floor, chin to chest. Coming to a standing position, you're going to gently bend your knees, round your back, and aim to touch your toes. Getting ready to come up, slowly stand back up, bringing up your head last. Same thing, but you're going to keep your knees straight, lean forward with a flat back, and aim to touch your toes. It's absolutely fine if your hands only reach your knees or your shins. You just go as far as you comfortably can. Gently bend the knees and roll up to stand. In a lying position, you're going to bring your right foot over your left knee. Go ahead and reach and grab anywhere on the hamstring or on the shin of the left knee, and gently pull that knee in towards you. Same thing on the other side. Bring your left ankle over top of your right knee. Go ahead and grab the hamstring or the shin and pull that knee towards you. For those of us that want an advanced stretch, we can come into a pigeon pose by bringing your right ankle towards your left wrist. Go ahead and scoot your left leg back. Drop your right hip. If it feels comfortable, come down onto your forearms. A seated variation for your glute stretch is to bring your right ankle over top your left knee. Gently push the knee down to parallel to the floor as much as you possibly can. And with a flat back, you're going to bring your chest close to your shin. So you shouldn't be rounding your back to come down like this. You really want to make sure you have a nice, flat, straight back. Aim to lengthen your spine as you bring your chest down. Same thing other side. Go ahead and bring your left ankle on top of your right knee. Make that shin as parallel to the floor as possible, and lengthening your spine, fold forward. Coming into a plank to strengthen the intrinsics of your spine, you can do so from your knees in your hands, your knees in your forearms, or come up onto your feet for more of a challenge. You're aiming to pull your belly button in towards your spine and hold for as long as you can. Our last exercise is a spinal twist, so you can cross your left leg over your right, bend your knees towards the left, and look out to the right. When you're done, same thing on the other side. Cross your left leg over your right, drop your knees to the right, and look out to the left. When you're done, bring your knees into your chest, hug your knees towards your chin, gently come down, roll onto your side, and push yourself up to seated. Thank you for joining me today.